Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 19, Ferrum phos-3. Male genital symptoms of Ferrum phos. Irritation and inflammation of prostate. Picture 1. With calamure, that is with calamure, Ferrum phos is to be given. Varicocele. Varicocele actually the inflammation of the cord-like structure which keep the testicle suspended, that is varicocele. That is varicocele means inflammation of that particular thing. Orchitis, inflammation of the testis. Bubo, gland inflammation, particularly lymph gland near groins. In all first stages, there is feverishness, pain, throbbing, chill. In all these cases, Ferrum phos is the medicine. First stage of gonorrhea, mind this, first stage of gonorrhea. Gonorrhea is a very complicated sexually transmitted disease, you know, gonorrhea. It is commonly called the clap. For first stage of inflammation, this is the medicine. Can be used as preventive medicine along with calamure if exposure is confirmed. That is, if a person reports, you are a doctor, some patient comes and report to you, sir, I have been exposed to some gonorrheal female patient, sir, please can you give me some preventive treatment? Yes, you can give. If he just simply admits that he has done something wrong and he has been exposed to gonorrhea, it can be given as preventive medicine. Can be used as preventive medicine along with calamure if exposure is confirmed. But mind it must be confirmed. Give 3x, 6x, 12x in gradual increasing dose for at least 1 month. Maybe more than 1 month may be required, because you are giving it as preventive medicine. That is the medicine that the gonorrhea will not catch him. It is possible. It is written in the book that yes, it can be used as a preventive medicine. This is very nice use of Ferrum phos. Female genital symptoms of Ferrum phos. To remove pain and feverishness during metritis and vaginitis. Metritis means this metritis, the picture 1, and vaginitis picture 2. Metritis is uterine inflammation. Vaginitis is vaginal inflammation. The wall of the vagina is inflamed. Vaginismus with excessive dryness and sensitiveness. That also got the symptom. Vaginismus, spasms of the vagina. This symptom is something hysterical symptoms. There is no pathology in the vaginal wall, but the patient goes into spasm due to vaginismus. There is spasms of the vagina. He feels spasms in the vagina during coition and do not allow others to make any intercourse with him. This happens, but if you actually check, you see there is no pathology, no trouble. This is Ferrum phos is the only medicine here. Natramur also, depending on the situation. I mean, if it is a patient of natramur, then natramur must be given. The first stage of gonorrhea, use local application. First stage of gonorrhea, I have already mentioned in just previous slide. Local application, that is, you make powder 3x. Ferrum phos 3x, make powder, mix it with the Vaseline or glycerin or olive oil and use it locally. In that case, cure will be faster. Dysmenorrhea, MAC-phos. Mind it, MAC-phos is one of the very popular medicine for dysmenorrhea. So that has been mentioned here. But here the case is something else. When there is congestion, fever, vomiting of undigested foods. This is the picture of dysmenorrhea of Ferrum phos. MAC-phos has got some other picture. You please consult that thing. If these are the symptoms, then you give Ferrum phos. If there is congestion, if there is fever and vomiting of undigested food, then Ferrum phos. Otherwise not. In dysmenorrhea, it should be taken in between periods as a preventive measure. Look this, as a preventive measure. As a preventive measure, you can also use MAC-phos. As a preventive measure, you can also use Ferrum phos. If this is the situation, this type of symptoms is there, you use Ferrum phos. Between periods, 6x twice a day, throughout the gap, and between two periods, that is a gap, 1 month. You give it and the patient will not feel any dysmenorrhea in the next cycle. Mind it, the menstrual blood of Ferrum phos is bright red. This must be there. If it is not bright red, then that case is not actually case of Ferrum phos. Congestive dysmenorrhea before first day of flow. Dysmenorrhea with frequent urging to urinate, menses every 2 weeks, that is short period is shorter, profuse pressure on abdomen, small of back. Small of back is a technical thing. Look this here. The small of back means actually L5 level. The curvature just of the buttock is called small of back. There is pressure on this place, pressure feeling by the patient, and pain on the top of the head. The top of the head. Pain of the top of the head. Here L5. There is also pressure, and abdomen also pressure feeling. This is a picture of congestive dysmenorrhea, Ferrum phos-3 medicine. Pregnancy and labor symptoms of Ferrum phos. First stage of mastitis. Now what is mastitis? Mastitis is inflammation of the breast. Morning sickness. Morning sickness, the lady who is just conceived, he suffers, or during his conception period, throughout the labor and throughout the pregnancy period, he may suffer from morning sickness. That is, in the morning, vomiting, nausea. This is called morning sickness. After pains, as a preventive, after pains means after delivery of child, there may be severe pain. This is a technical term, after pains. Technical term, after pains means always refer to a lady who has just given birth to a child. As a preventive of lactation fever and puerperal fever. Mind this, after pains, lactation fever, puerperal fever are all troubles of delivery, after delivery. And Ferrum phos is a very good friend in the gynecological department of biochemic hospitals. Respiratory symptoms of Ferrum phos. Acute initial stage of all inflammatory affections of respiratory tract, rhinitis, laryngitis, tracheitis, bronchitis, pneumonitis, pleurisy, thysis, etc. Expectoration of scanty. Mind it, here expectoration of scanty, because you know Ferrum phos is a medicine for primary infection, primary stage of infection. Though there is no expectoration, that is scanty expectoration. The expectoration may be blood streaked, and that blood would be red, bright red, chest sore, bruised. This is the picture. See this laryngitis. Third picture. Larynx is severely affected. Laryngitis. This picture is taken from laryngoscope. You cannot see this in open eye from outside. And this is pleuritis. That is the pleura. This area, and also this area. There are two covering of the lung. These are called pleura. The pleura has got two layers. Within the layers, some fluid is accumulated due to inflammation, and for that reason patient feels very stitching pain during respiration. This is called pleurisy. Generally this pleurisy occurs to infection of tubercular infection. After it comes generally thysis, or after thysis it may come also, and this is hemoptysis, that is bleeding from mouth. First and chief remedy for stitches in chest: catch in the breath, dyspnea, cough, and should be continued till free respiration is established. This particular line has been given by Doyne of tissue therapy. See this, when you feel stitches in chest, that is catch in breath, that is you are going to be affected with pleurisy. Some dyspnea, cough. This medicine continue this medicine. He is telling that continue this medicine till free respiration is established. Give him, the disease will be nipped in the bud. Congestion in lungs with debility of pressure. There is some serious infection is coming in the lung area. Hemoptysis. This is hemoptysis coming out of blood from mouth. After concussion, that is a very serious jerk in the brain or fall injury, with short oppressed breathing and high fever. This is accidental case when Ferrum phos may be given. So Ferrum phos, covering of Ferrum phos is very great. It's very great. Respiratory symptoms of Ferrum phos continue. When there will be two dots, please mind it. Two dot means it's continuing from previous. Short, painful. Tickling cough from an irritation in trachea. Spasmodic cough with involuntary spurting of urine. Hard, dry cough with soreness in chest. Cough with rattling mucus in chest. Worse at night. Mind it, all type of cough. Various types of cough described here. Almost in every type of cough, Ferrum phos is the answer. Whooping cough, picture 1, with gagging and vomiting of foods, particularly of young children. Loss of voice due to strong laryngitis, already picture has been shown. Hoarseness, huskiness after prolonged use of throat in singing, speaking. Public speaker, clergymen, singers used to suffer from this hoarseness, huskiness, and Ferrum phos is their friend. In bronchial affections, that is bronchitis, with heat, burning, soreness in chest, but no expectoration, that is in the first phase. In the first phase, there is no accumulation of fluid, so there is no expectoration. But there will be burning, soreness, temperature. In that case, Ferrum phos will take. When there is accumulation of fluid, then Ferrum phos will cannot do, he will fail. Calamure, you have to take help of calamure or calcarea salve. Now, note this figure. This is normal bronchus. This is inflamed bronchus. Bronchitis means actually inflammation of the bronchus. See, due to accumulation of fluid or the wall, bronchial wall, the space, the lumen of the tube has been narrowed down. This is bronchitis. Life case. Mr. A.B. Khan, aged 42 years, came to my chamber to report that he had been suffering from pain in pelvic region with burning in urethra during menstruation for last 5 to 6 days. His face looked swollen, toxic. His feet were swollen too. Before prescribing remedies, I ordered for an urgent ultrasonography of kidneys. Next morning, Mr. Khan arrived. I noted that my presumption was right. USG report showed inflammation of kidney tissue. He had been suffering from acute nephritis. I prescribed Ferrum phos 6x 4 times a day for 3 days. Light veggies oriented food, avoiding animal protein for the time being. 1 liter water a day and full rest. Also advised to report me on phone on every night after 8 p.m. At 8 p.m. Mr. Khan reported he was feeling much better, though symptoms were more or less same. I advised him not to worry and continue the remedy. Next evening, Mr. Khan reported that burning sensation gone, frequency of urination less, etc. etc. I had to give him Ferrum phos 12x a day, twice a day for 3 days more. Acute nephritis gone completely in a week. Now, discussion. Why should I prescribe medicine? Why I avoid prescribing medicine for the first day? See, from the symptoms, I presume that that person might be suffering from some kidney trouble, but I didn't know what was the trouble. When ultrasonography report come, I noted that yes, some acute inflammation is there. Since this is acute inflammation, this is a case of Ferrum phos clearly. Then what I did, I asked him to take vegetable oriented, rather food oriented foods for the time being, just 1 liter a day, not to give much pressure on kidney, and full rest. And advise him to report every day, because acute nephritis is a serious disease. It may turn into bad shape at any time, and if that happened, then I had to advise him to take the help of hospital. For that reason I advised him to report me every day. But he was fortunate enough that it was not the case. He promptly responded to my medicines, and he was cured accordingly. With this, the video ends. Thanks for listening and viewing. If any difficulty you feel,